Hello and welcome to the Northern Rose podcast. It's me, Henry North, a freelance journalist from Manchester, and in this episode I talk to mental health care patients from a group in Beswick. It's a group of around 25 people who meet twice a week to check up on one another. As part of Manchester's mental health care crisis, members of the group receive very little or no help from the NHS and use the group as their main source of support, leaving them some of the most marginalised people in society. The group is run by a retired nurse, Annabelle Marsh. I asked Annabelle what kind of problems group members deal with on a day-to-day basis and what some of the reasons behind starting the group were.
Well, they face the problem of having serious mental illness, which can affect the way you think and behave. And that's difficult generally for sometimes family, friends, or the wider community to understand or recognise or deal with. So there's that issue. There's an issue of medications which are often necessary, or people feel they're necessary, but they have consequent side effects. It might mean that your psychosis is better controlled, but you might be feeling very sluggish. You might have all sorts of muscle or other side effects from that. You might lack motivation. The mood might fluctuate. So those are very difficult on a day-to-day basis to deal with. Then family relationships can become very challenging because other members of the family may be concerned, but they may not understand. They may have their own issues to deal with. And then you've got daily living stuff like your housing issues, how to budget, how to read and write, how to keep your place clean, eat properly or healthily, whether to understand those things, everything like that. Yeah.
It's difficult, isn't it?
It is very difficult. When I was working, it just seemed as though there were issues that people had in common. Like, for example, bipolar disorder. People might be told they'd got bipolar disorder, but they didn't know what it was, really, and they had never met anybody else with it on a serious level that requires a community mental health psychiatric input. So getting people together to share experiences and management ideas and tips on how to look after themselves, etc., just seemed like a good idea. The value of the group is that people aren't alone and that other people recognise. I mean, sometimes I don't recognise. Somebody will say, "Ooh, so-and-so's not very well today." Or they'll tell me about a particular thing that they've disclosed. Not breaching confidentiality, but just saying, this has happened. So you can therefore intervene and say, do you need a bit of help with that? It's not difficult.
And that speaks to the community values of the group, doesn't it?
Yeah. And people understand how the other person lives. So it's not a judgment. People aren't, they live like this. It's not like that.
It's more looking out for the other person, isn't it?
Yeah.
I then asked Annabelle what some of the main challenges are for people who use mental health care services.
The frustrating thing at the moment is you can't just ring and get support. Even if you're under the outpatient department, you can't just ring and get somebody to ring you back and talk to you. So there's no immediate responses to help. People get told to go to A&E. I spoke to Bob and people like that, but he was in there for 9 hours and still didn't get to talk to anybody. Well, if you're not feeling good at all, sitting in A&E for 9 hours is not helpful. Doesn't work.
Especially at night.
Oh, yeah. And that's what people are saying. I mean, I looked at Wes Streeting's latest big idea, local services. I think mental health could be. They've got number 93, which is in Harper Hay. They could have places like ours, which is set in a community centre, could be open all the time with staff. I don't mean staff to tell you you're not allowed to come in. They need to be places where people can go and meet their friends, but also access support if and when they need it. Not in the sort of barrier, you've got to be referred, we can't talk to you because you're not under our team. People need to be able to talk to somebody who can then contact the right people about whatever problem, because services are divvied up. So that if you're under a certain GP, you're under a certain doctor, consultant, psychiatrist, but you need somebody who's not going to say, you're not under the team I work for. Or say, I'm listening, I can contact the right people, and they respond fairly quickly. Because since COVID, we've had at least 7 admissions of people from the group, and each one has involved the police. So that person is in extreme crisis. The police have had to be called. Now, none of those people did not display signs of relapse. It wasn't an immediate, massive crisis in that hour. They were relapsing for quite a long time before. I know that a lot of people don't like the words like relapse because there's a lot of issues around diagnosis and trauma-focused, whatever. But people are displaying signs that they're becoming very unwell. If you can act then, hopefully you can prevent it. I was trying to tot it up the other day. People have been in for at least, altogether, 7 or 8 years. If you add up the length of their admissions, many of whom have ended up in private hospitals. We've got somebody in a private hospital now. In fact, 2 people, I think, which cost an absolute fortune.
And that's between maybe 40 people?
40 people, yeah. And part of the problem is when people talk about mental health, I heard somebody on the radio yesterday say, no, you shouldn't get pipped for anxiety. Well, we're not talking anxiety, and I'm not putting anxiety down. It can be very debilitating and part of a serious mental health problem. But when you're talking about the sort of people who come to the group, you're talking major issues.
Yeah, it's different.
It is different. And their risks are higher. And if they've got no services, you can't intervene. You've got to wait till that person is in a massive crisis.
And it's that level of trauma on top of that as well, isn't it?
Yeah, it's huge. And especially for families who have to phone the police. It's really, really difficult. It doesn't have to be like that. I'm not saying the olden days were good, because they weren't.
Yeah.
But there were better funded services. And the people who don't shout, people like the group members, are the people who don't get anything.
I also asked what kind of care Vinny, who you'll hear from later, currently receives.
Very little now. Yeah. He gets an appointment probably twice a year with a junior psychiatrist.
And is that typical?
Yeah, more than typical. Yeah, because people are being stepped away from community mental health teams. That concept has basically got, and those teams now manage crisis or people coming out of hospital. As far as I can see, they're constant state of flux and reform. Plus, there's no input into fostering a team ethos because so many other fragmented services are being set up. These aren't usually for people with long-term needs, and people are offered slightly better pay or conditions to do that work. So at the moment, as far as I understand, in North Manchester and across Manchester's particularly bad, the teams don't have continuity, they don't have a set workforce, and they're firefighting continuously, crisis after crisis. Stats for North Manchester are really difficult. It's very deprived, a lot of very poor people and very poor health outcomes. We had 2 people die since 2020, both of whom were in their 50s, who used to come to the group regularly, both of whom died from physical health problems, both of whom had been stepped away from community mental health services. Those causes of death won't be related to mental health in any way by a coroner. But my theory is if somebody had been going in regularly, they might have realised. Especially one of them, a lady, she was extremely overweight and breathless, very small woman, huge. It wasn't her fault, but nobody was bothering to help. We don't know, do we? You know nothing. You don't know whether she'd be still alive had she had more appropriate support. It's not recorded anywhere. You know, the prevention of future death stuff that Charm did, neither of them would have come up on those.
For what reason? Just
because the cause of death wasn't mental health service related, because one person died of a heart attack and one person died of lung disease. Yeah. But she was extremely overweight. You just don't know. I'm not saying they wouldn't have died. I'm just saying that they weren't getting any services. They were on medications that contribute.
They weren't given a chance, really, were they?
No.
I then spoke to Mark, who'd been going to the group for 15 years. Sadly, Mark passed away not long after the interview, becoming the group's 4th loss since 2021. Statistics show that people with long-term mental health issues can have up to a 20-year lower life expectancy. And with Manchester's life expectancy already being 3.5 years lower than the national average, The numbers show how difficult life with long-term mental conditions can be. I started by asking Mark what his diagnosis was.
I've had different diagnoses. I think at the moment it's anxiety, depression with psychotic features. It can be like I can feel very anxious, very agitated all the time. Also, it's like you don't quite know what's going on. You know what's going on, but it's very, very frightening. You know, if you started to get panic attacks or you may start hallucinating or things like that, it's terrifying, you know what I mean? You know there's something wrong, but you don't know what it is, basically. So I think what you do is you learn to live with it. What else can you do? It's incurable. They are incurable. Well, they say they are incurable. The best they can do is stabilise you with medication, really.
And when did you start developing mental health conditions?
When I was in the early 20s.
Was there any kind of trigger or...
I don't think
was
so,
it
you
just
know. I just started feeling unable to sleep, and then I was getting thoughts, and my thoughts were going a bit, but there's something not right here. And I started to think like the television was talking to me all the time and things like that. And I didn't understand what it was, and I'd stopped going out. And my mum said, "What's up? Why aren't you going out to the match?" I said, "I don't know, I don't want to go." I didn't know what was going on. I didn't know what was happening. And then I'd go, I couldn't sleep, and I must have gone 5 nights without any sleep nearly. And I had to go to A&E, and they gave me some medications and all that, and that's how I got started with the psychiatrist and everything. So I was admitted into hospital. I was sectioned twice. So I didn't know what was wrong with me. I was just, but they knew. I think they knew a bit. But it was really strange, and very frightening. Very, very frightening.
How did you come across this group?
Well, we used to go to other groups. There used to be another group on the other side of Beswick called Having a Voice, and that closed. And then, we found this one, which wasn't here originally. It was in Harper Hay. We used to go to the Harper Hay Neighbourhood Centre. And so that's how I found it,
And it was just through like talking to people that you made aware of it?
There's a group at Harper Hay, so that's when we all started going. A lot of us from Having a Voice, quite a few of us went to these groups after Having a Voice got closed.
How important is this to you to have?
It's important. It's very important. I think a lot of people would be lost without it.
Is the main thing that you're able to chat with people who kind of understand?
Yeah. That's exactly it. Yeah. It's a peer support group, so people don't understand mental illness. They just don't understand it. You know what I mean? I'm not saying people may have an idea, but unless it's you've had it or you can talk to people, and what you're saying might sound a bit daft or weird or strange, or people will understand. You know what I mean? They'll say, yeah, we've had this as well.
And do you feel when you say people don't understand?
I don't think the public understand mental illness. No. I think they understand stress and things like that, but they don't understand mental illness.
But how has mental health care changed?
Worse.
It's worse. Yeah.
When I was first ill, when I was in my 20s and whatever, I was in hospital 7 or 8 times and whatever. But the mental health, the care then, and the facilities or whatever were 10 times better than they are now. I mean, they used to have art therapy at say Crumsall, Springfield. But if you got discharged, there was a day unit. You could go every day. McCartney Day Unit it was called, and it was really good. Yeah. And there was art therapy. A lot of the patients used to go to art therapy, and then there was Mainway. A few of them worked at Mainway, and they shut everything. They shut everything down. It was go away. We don't want you here. The trust. That's the trust. These people that run these things, they don't care about the patients at all. They don't care about the patients at all.
So you say that they don't care about the patients because...
I think a lot of it is about money. But, I've seen it. I don't think they do care. I don't think they're that bothered a lot of the time.
What kind of examples are there? Is it that when everything closed, they just sort of said, you're kind of alone now?
Yeah. But it's they used to have acupuncture at Park House, and I used to go there and have that. And this nurse, he was really good, Chris, and he tried to get a better room for patients. And then some of these managers said, oh, we've got a spare room here. So he said, Chris, oh, we can use this for the patients. Oh, he said, no, it's not for the patients. So he said, well, what's it for then? What's this place for? So they trundled off. And many examples where the patients weren't the first priority. It was about finance, money, and all the rest of it. And they think to yourself, well, they can't care. They don't care. They're not bothered. They just leave people to fend for themselves. And then that's one of the worst things, because when people get isolated more, you know, well, they'll go worse.
It makes your condition worse.
Oh, yeah, yeah. Well, you're on your own, aren't you? Or whatever, it's no good at all, things like that.
For you to see how the mental health care has developed over 15 years, how does it make you feel?
Well, I think it's disgusting. I think mental health care is not on. They said there's a parity between physical and mental health. There isn't. I mean, both are bad now. I'm in the state of the NHS now. But mental illness is like, like I say, people are very ignorant about it. They're very, very ignorant about it. And they just think, oh, it's all in their head, like, you know what I mean? Well, it's in well, it's your brain. Well, people with mental illness, when it's chronic, they develop other physical illnesses. Yeah. I've got diabetes, pancreatitis and things like that. So your overall health goes down the swanning.
I asked Mark what care he was getting.
I've just, a nurse has been coming to see me recently. Psychiatric nurse coming tomorrow to see me. So there is some help, but you've got to be pretty bad to get help.
Yeah.
You've got to be pretty bad to get help. A lot of people don't qualify for being under the mental health team and that. It stepped a lot of people down as well. I think it's more whether they think you're stable. So if you're stable and then you feel a bit better, that's what they've done about 4 years ago, 4 or 5 years. They stepped a lot of people down.
Yeah.
And it was all about money again. It was all about money, basically.
But the people who were okay, that's probably because they were getting the care they needed.
Yeah.
So when they got then stepped down.
Yeah, when they get stepped down, then they'll, they could break down again.
Yeah.
If they've not got the support.
And the irony of that is, had they not stepped them down, it probably wouldn't have cost as much.
No, exactly.
As when you then need that extra layer of care.
Yeah. It's a stupid system that they have. But this trust that we're under, they're useless. They are completely useless.
Do you ever get asked for feedback or how things can improve?
Oh yeah, and we've done that. We've told them, yeah. But they don't listen. Yeah. Oh, they'll say we've got no more. Well, once there was a nurse a couple of years come. She was the chief deputy nurse of the trust, and she said to Annabelle, and we're going on about the funding for her, and she said, "Oh, I'm sure we could get some money for you to help with the funding." And there was no money. She never got back to Annabelle. And then another one came a few months ago, and she said, "Oh yeah, she shouldn't have said that." So we said, well, she did say it. She promised us funding. And she said, we've got no money anyway. That's the truth of it. So, well, she was lying as well, perhaps.
Yeah.
Honestly, I God.
Well, you were lied to by one of them.
Yeah. Deputy Chief Mental Health Nurse for the Trust. That's what she said. How can you have a system where they just built another hospital on the site of Park House? It cost £106 million. But the community services, only 5%, I think, of the patients are inpatients. 95% or something like that are outpatients. But the community services, that so-called thing when they'd done it, like Thatcher and all that, was like caring the community or something like that. A lot of rubbish. It doesn't exist.
Next, I spoke with Rachel, who takes on the important responsibility of being one of the group cooks. As some of the group members may struggle to make fresh food, Rachel studies a food course to try and encourage other members to improve their diet. I started by asking how long she'd been coming to the group.
Well, I've lost count of years. It's well over 10, possibly 15. And we've been to many different venues. We've gone from place to place and we finally found this place. Then we got shipped out to another place and now we're finally back here. And I feel like this is the right place for us. forgetting everybody can get to it, no matter how long it takes. We always get here. To me, it's my lifeline. I can be me. I can talk about me. I can help people. There's loads of different little things that this group helps me with. I like helping others, so we're waiting on and getting people sorted. And I see all my friends twice a week, which I look forward to. And my other friends are all quite well to do and have jobs and they've got a lot of money, and I don't fit in half the time. They don't notice I don't fit in. I notice, and I can't talk about myself or my life or my illness. I just listen to them. I do love them, but this is unique here. This is my lifeline. I've got bipolar affective disorder. I've only been diagnosed with bipolar for a number of years. I used to be diagnosed as like schizophrenic, severe mental health issues, and used to give me injections for psychosis all the time. And I was like that. If you saw me years ago coming in, I was like that. I had these depots, but up to date for the last X, Y years, bipolar. Obviously, I've got renal, my kidneys have failed. I've got renal kidney disease. I have asthma. I've got an arthritic foot that needs surgery. But my main diagnosis for mental health is bipolar.
What kind of support do you get from the NHS now?
I've got a CPN. She doesn't come very often, but on paper I've got one. But I don't really see her.
And when you say she doesn't come very often, what does that look like for you?
Well, she's got such a busy schedule. When I'm free, she's not. And when she's free, I'm not. There's dialysis in the group, but she's there on paper. She's coming round next week, if she don't cancel, to get me on, manage to move, so I can get a bungalow or a flat. So she's coming on Tuesday to do that.
So how do you communicate with her? Is that on
text?
And if you needed her in an emergency?
I think they'd just say go to A&E. That won't happen. She won't be available. They turn the phones off at 5 o'clock. You're not allowed to speak to any clients after that.
And that's work days as well, so Saturday, Sunday?
No, you can't get hold of them now.
And that is the full extent of the
Monday
current?
to Friday, working hours, you see your CPN can answer you or ring you if they're not busy, because you've got so many clients. So at weekend, you just get to the phone, 111 or go to A&E. When I was first taken in mental hospital, I was 17. I got taken in Springfield, and that was before they built Park House. And now Park House is gone, they've got the new build. I know it's awful, you don't like being in hospital, but it was better to me being in bed than being at home. And the staff were great. The whole place was disgusting, but all the staff spent time with you on the wards. You never enough you could do for you. You know, they didn't go in an office and be like that all day because they didn't have that. They just spent time with you, gave you all their time, and we had laughs and we had nice times. And then as the years have gone on, I've been admitted and sectioned more times than I can remember in my life. My background was an abusive childhood, so that makes me very wary of men.
Yeah.
And then when I was in Park House years ago, I got groomed by one of the support workers, who then when I was on a day at home, was allowed a day at home, turned up and sexually abused me in my own house. So that's how I am with men. So then I've got this thing about men. So my friend come round. I've been ill for days, really ill, and I've been in the bush shelter in the dark watching out for them with a knife. And then my friend came and I was really unwell, so she phoned. I think she must have phoned someone. I don't know who she phoned. And next thing the police turned up. 2 police ladies. They turned up, fair enough, and we all sat in my house, all talking to me. So I was saying to me, Rachel, you can't do that. You know, you can't have a knife, blah, blah, blah. and my friend was going, and he was trying to get the team to come in, the section to come to my house to section me, and the police are there, and they have to stay with me, but they can't arrest me. It's a section something where you can't arrest you in your house. You've got to be off your premises, but they can cuff you and not section you, arrest you and bring you in for sectioning. So then my friend was going, I should be in there hours, and the police said, go and say bye to your friend. So I went to the door, and she went out and she went, oh, come and give us a kiss. And the minute I stepped out my drive, put handcuffs on me, arrested me. Then they needed a van to bring me to the station because they were in a car. So there's no way I was getting in anyway. Then brought Black Mariah, White Mariah, whatever they're called, and they bundled me into the back, begging them, cuffs were really hurting. Yeah. And I was begging him not to put me in the cage at the back. And this horrible bloke who came was so horrible to me and threw me in. Anyway, one of the police women must have felt sorry for me, and she got in the back with me and took me to hospital. There's nowhere to put someone with mental health problems. So they put me in a kitchenette in A&E, a bit of a sink, a couple of chairs, and a door. So they sat me there, police ladies either side of me, and the policeman covering the door, and I was like, what am I going to do? Police should have finished at 11 at night, but they still hadn't got the transport to take me to Norfolk, because that's the only place that had a bed. So we sat in a kitchenette on a hard chair for about 8 hours, or even no more, about 10 hours, and I wasn't doing anything, I wasn't creating. So they all had to stay overtime because there was no one to relieve them. So they should have finished at 11, so they weren't best pleased, so they weren't very nice. They had to stay till the ambulance came and took me. Now a private ambulance appeared about 6 in the morning, and they bundled me in there with 2 private ambulance people and the driver. And I went to Norfolk and I cried and I cried and I cried. And they brought me back 2 days later because there was a bed here. I travelled all that way for 1.5 nights to bring me back. There's a logic in that. So that was one of my worst experiences. So the support worker got arrested. Got taken to court and he got 3 years because there was 2 charges. There was sexual assault and there was rape. And he agreed at the last hour, the last minute, he changed his plea from not guilty to sexual assault. And it worked because I just could not go any further. I gave up. I said, I'm not going to court. I'm not going. I'm not bothered about the rape charge. So he would have got 10 years then. I was broken. The case was just dragged on and it was awful. So I got 3 years anyways. We're roaming around now, I don't know where. I still have fears and I still worry. And I still have all sorts in my head. I still check behind my shower curtain every night, in my cupboard, just in case he's going to get me. It's basically made my life a lot harder.
I also talked with Bob, another member of the group, and asked him when was he first diagnosed with a mental health condition.
I was diagnosed in 1993, unipolar and severe depression.
And how long have you been coming to this group?
Approximately about 12, 13 years, I think.
And how did you find out about the group?
I found out through my CPN, and my care coordinator at the time, a support worker. She introduced me to the group at the time, back then, quite a few years ago, 12, 13 years ago. And that's how I come involved in the group. And I've come ever since, come every Tuesday and Friday, Yeah. And then when I need additional support, I see Annabelle and I see people, I get additional support in the group when I'm ill, and I go quite poorly. So it's a big factor really, coming here, you know what I mean? It's a big help, a really big help.
How important is the group to you?
Very important. Very important, because you won't get another group like this anywhere else. You're amongst people who's got the same illness as you, so you can talk freely. You know, you can talk freely. If you get upset, if you get tearful, it don't matter, because everyone's in the same boat, you know. So it's a big help. Big help.
And what kind of support do you get from the NHS right now?
Very little at the moment, very little. There's a crisis cafe where you can go at night, but again, you only get allocated an hour to go there. And when the hour's up, that's it. That's it. It's an hour, and that's not long enough to express everything. If you're really poorly, you need more than an hour. An hour's just not sufficient. So I get very little support. I get quite a lot of support off my doctor and the mental health worker at my doctor's. I do get quite a bit of support off my doctor.
And what is that kind of support?
Off my doctor, he has a mental health worker. When I had an episode of being really unwell quite a few months ago, and she contacted me daily, and I was invited to go in and to see her as well. So that was okay, you know, with my doctor and my mental health worker.
How has the type of support that you've got now changed?
It's declined over the years. Like I say, I used to have a CPN. Once a week he used to come and see me. And there was another group where I used to go to on a Friday morning for people who needed injections and things like that and medication. But that's finished now, that's gone. And that was another group where we could meet, have a cup of tea with the CPNs, my CPN and other people, have a chat and get treated. But again, I don't go to that now. And that's gone. So it's declined, really has declined, the services on the ground, you know.
So if your condition was to get especially bad,
Yeah.
where do you go?
The only place you can go is A&E, where I did go once. A very, very bad experience in A&E. And I'd never go again, never.
Would you mind just talking about a little bit about the lead up to your diagnosis and what kind of triggered the breakdown?
I had a breakdown in my marriage and my business in 1992.
You were a taxi driver?
I had an Hackney cab,
Yeah.
and I also had a shop.
Yeah.
We run the business, my wife run the business, and I had a breakdown in a relationship in 1992. 1993. From then, I was homeless for 8 months approximately. Sofa surfing and staying at Salvation Army and various men's hostels. 1993, I went quite poorly. And then I got diagnosed and admitted to Park House Hospital. That's when I got diagnosed with my illness, severe depression and unipolar disorder. And from a spell in hospital for, I think it was 8 weeks. Before I left hospital, the social worker arranged me to get a flat to live there, to live in. And I've been under their services ever since, you know. At that time, I was appointed a CPN and a support worker. And that was in 1993 or onwards. But that's not the case now. I don't have anything like a support worker or a CPN now.
Do you think if someone was to have the same experience that you had back in 92,
Yeah.
now, do you think that they would get the same support?
No. They would not get the same support as what I got then. Not a chance. I don't think so. No. I doubt it very much.
I then sat down with Vinny, who talked about his life before his diagnosis.
No, the quality of life weren't good. It was horrible, to be honest. It was things like I was taking overdoses. I don't remember it, but apparently I was found wandering the streets one night, crying, and I'd lost a shoe and I'd damaged my knee. I thought I'd had an operation on my knee, but I just remember just being sent home the next day in a taxi, just vaguely, and I never found out, and I still, what was the help in the, I don't know what the help was I got. So whereas that compared to being up here now, yeah, it's been a massive improvement. Because it's a horrible thing to say, but I'm not sure if I didn't come here, I'm not sure I would still be here, if you know what I mean.
And was there a moment that really triggered your bipolar, or was it a thing that developed over time?
Yeah, I think it's always been there, because in one way or another, since I was 14, about 14, I've had mental health problems, and I'd say they were quite bad. But as I got older, I began to notice my mood changes and what have you. And plus, I can't remember where, but I'd heard of manic depression as it was then. And as I got older and I began to understand like how I was feeling, yeah, I knew it was definitely bipolar. And then one day, I was that bad that I got taken to the hospital, but I was just given a few tablets, so...
Just a few tablets and then sent on your way?
Yeah. Like that time I was put in a taxi, like I said the night before when I was found. I only very vaguely remember being put in the taxi afterwards, and I was basically left to it. So up until then, it was just a case of going to see my GP or going to the hospital, which I preferred going to my GP, but I knew that even my GP admitted he's not a qualified psychiatrist, so he can only give me antidepressants. But yeah, it was just a case of here's a few tablets, get on with it.
For people that don't understand or haven't suffered from mental health conditions, when I met you, you said that you had struggle sleeping.
Yeah.
How long can you go without sleeping?
Longest, I got up on the Sunday about 11ish, and I remember still being awake. I remember seeing the clock on the telly. I remember seeing 2:10 on the Thursday, so it was like 11 Sunday morning, so about 2 o'clock Thursday morning, and I think that's the longest I've ever done it. Or like a couple of weeks back, I got up on the Saturday and I didn't go to sleep till Wednesday morning. Oh. It can be one night, it can be 5 nights, or it can just be in the morning. But when I start feeling tired in the morning, usually kicks in about 6. I don't go to sleep because I'd rather sort of save it till the night time and try and sleep proper. I don't know, it's always been there. I'd say that was the bipolar, plus I reckon a hell of it a lot. It goes back to my childhood. But I'm used to it now. I don't think it's ever going to change.
I asked Vinny what care he currently has.
The sleeping tablets, I go to my GP because, like I said, I've known him for years, so he knows what my sleeping is like. And usually I'll ring my doctors, ask to speak to him, and he'll ring me back about an hour later or so. And I'll explain to him, and then he'll put a prescription in for a couple of Zocloclone. But now they've decided, I don't know why, I've got to go for a review, which is where I'm going after here actually. But to get them from the hospital, I've never got them from there, but to get them from the hospital, it'd just be so stressful and what have you, that I probably wouldn't bother. Because like I said, a couple of weeks back when I was up from the Saturday till the Wednesday or whatever it is, I just ran my GP, and then when there was all that messing about, I did think of ringing the hospital, but I thought, no, it's just too complicated and just too stressful.
And why do you find it stressful?
It's just the way that it's run now. I've had appointments in the past where I've gone for my appointment, it's been cancelled, but nobody's actually told me, so I got there. They give me a new appointment. The second time it happened again. I got there and it had been cancelled, and then they tell you things like they put you on a new medication and they want to monitor you because apparently it can affect the heart. They said for 3 months. It ended up being 7 months, and nobody monitored my heart. Nobody told me why, and then just out of sheer desperation, I handed all my medication back. I just said, "Here, you can have them. I'll just get in bed." It's a lot less stressful and horrible, and it's just easier to be ill than try and get help. And plus, I asked to speak to my doctor, my psychiatrist. When I asked for that, I politely asked him why doesn't the psychiatrist answer the phone. And your woman on the reception, she asked me straight away, had I just rang, was it me that was abusive on the phone? And I said, no, I've just got off 2 buses. So that's how long it took me to get my medication. And that's why I give it them back. But yeah, she mentioned about being abusive on the phone, and I said no, I ain't rang, I've just got off 2 buses. 3 times she mentioned it, asking me or accusing me and what have you. And then eventually found out that whoever it was had a completely different name, and when found out it wasn't me, I got no apology or nothing. And yet, if I'm expected to apologise to them if it is really, really horrible. It can be worse than your illness at times.
So I asked Vinny what changes would he like to see made to the care he was receiving.
One of the biggest things is being able to speak to someone when I ask, and actually, if they can't, things like just basic things out of respect, like if I get told the doctor will ring me, say, at 6 o'clock, the doctor would actually ring me at 6 o'clock about that time. Or the doctor I see, he's my permanent doctor instead of a different one every few months. Like the posters you've got all over the place, respect the staff, well, just general politeness and respect for me and everyone else. And a lot more understanding and compassion. The way it is now, you don't really see us as individuals. Like, you change, you get a different doctor that much that you know your illness, because that's what they're trained in, but you just don't know, or they don't take it into consideration that you are a person. And besides your mental illness, there's a personality underneath and all.
Following Vinny, I spoke with Jim, who told me about his story of being diagnosed and how his treatment has changed over time.
Various times in my life, from the early age of 19, I'm 59 now, so that's what, 40 years? 40 years. I was treated for depression, and they didn't really diagnose me until 1999 as being bipolar 1, which is the kind of nasty one. You are okay, and then you start to feel better and better and better, and you go right up there, and then everything goes wrong. Personally, arrested by the police for doing silly things, blah blah, and then you crash. And this crash has taken me, it'll be 2 years coming October to actually feel able to go out of the house and do things. And even at that, it's little things and as little as possible. Not because I don't want to, it's just because I'm my mum knew there was something wrong, and she was sort of trying to get me to the hospital up in Scotland, and I clicked my seatbelt and opened the door and just jumped out of the car at 30 miles an hour, rolled over, cut all my jacket, I had a denim jacket, cut all that, and she's like, something's really wrong. So she tried to get me to a hospital. Again, that's years and years ago, but the doctors just thought it was depression and the onset of anxieties. But they kind of left it at that. But as time went on, there's clearly something more than this. They need to investigate it, and that's when I was diagnosed bipolar 1 in 1999. Long time. I first started getting treatment or help was when I lived up in North Manchester, and I had a CPN, which wasn't Annabelle, but her name was Janine Jacob. She was fantastic. She was like a very, very good friend also, but very knowledgeable of what's going on. She then got me a support worker to work in tandem with her, and I got a visit from her every week, every single week. She would come in, she would spend an hour at least chatting about what I'd been up to, if there's anything she could help with. And she actually did the early diagnostic sheets that I've got laminated. I've still got them and they're still relevant because everything's the same. The triggers are the same for me, the recovery's the same for me. You know, it's like early stage, middle stage, dangerous stage. And all I need to do is look at these personally or with another nurse or whatever, and they're like, right, Jim, you maybe need to sort of think about bringing this down a bit, and if it goes to the next level, the worst case scenario is you kind of need to start thinking about maybe a week in hospital, which is never a week in hospital. Once they get you in, you're on a section. That's the end of it.
What kind of support do you receive now outside of the group on a regular basis? Or?
I feel I'm very, very lucky to still have services, to still have a psychiatrist. I used to get a lot more support than what I get now. My CPNs have moved to care coordinators, they pay them less and make them do more. And the one I've got just now, she's a South African lady, very good, but she doesn't like to talk to you. It's like, send me an email if you're in trouble, and she'll get back to you, sometimes on the same day, sometimes on the next day, or you get an out of office reply. I'm not that good on emails and texts and whatever, so I prefer to speak to people, but there's no point in trying to get her to speak to you, because even if she does speak to you, it'll be like 2 minutes and 10 seconds, and I can't really understand what she's saying anyway. So you just drop her an email and she replies, and you think, right, this is where we kind of try to go from there.
But it's not always easy, that is it, to send an email?
Well, especially with me, it's like since October 23, I've developed these like, it's not essential tremor. There's one, rubral tremor is a different one. They're like, could be that, and I've been to see like, they've kind of pulled back from both of these now, and they said it's not, we don't think it's either of these, there's something else going on. So I've seen 4 neurologists, and they still don't know. I've had a head scan, I've had lumbar puncture, and they're still like, we don't know what's causing this. So tremors, but typing things is really frustrating because I'm right-handed. I've got to keep pulling my hand back and sort of trying to stop it shaking and then start again, but it doesn't work.
How important is the group to you?
Immensely. I'm not great with words and things like that, but if there's another step up from immensely, it will be that. It's like really, really important, because again, a lot of us at the group don't actually get out as much as we should or whatever. A lot of us are single, which makes it difficult, because if you're single, you've got nobody to talk to, and you can dwell on the things that are wrong more than you want to, or all that sort of stuff. So in reply to that, it's brilliant. Brilliant's not the right word, it's more than brilliant. It's a necessity, because you go there, plus the fact you get to spend some time. Annabelle takes me from Charlton up to the group, so I've got like half an hour to chat to her before we get there. Just chit chat, but you know, she can tell by looking at me what level I'm at, type of thing. Which is good. See if you get ill on a Friday night, after 5 o'clock on a Friday, end of, that's it. There's nobody there till Monday, and then if you try to get them on Monday, they've got all the work from like Friday to try to get an appointment with the GP. When I was sectioned last, which was October 23, I had to go to my doctor because I was struggling and I wanted some diazepam to keep me calm and stop the anxieties of being released from hospital to, there you go, there's the keys for your flat, everything's going to be okay, see you later. So I went back to the doctor, and he didn't even know I'd been in hospital. Annabelle had been trying to get in touch with him for weeks, and quite blasé, and I've been in that surgery for 20 years, and we've got a really good rapport. And as he was tapping on his computer, he said, I didn't even know you were in hospital. And I said, well, you should have done it. I said, because people will try to get you. Or you can try something else like Samaritans, which is what I've done in the past before, twice in the last year. And I spoke to my psychiatrist about that. He says, that's a good thing to do. And I was like, it's not a good thing to do. I said, are you kidding? I said, the fact that I've got to phone St Martin's to stop, for them to tell me or help guide me into not taking my own life. I said, do you think that's okay? I said, that's your job. I said, you should be helping me.
To finish this podcast, I spoke to other members of the group and asked if they were to speak to a manager in the NHS, what would they say? And 3 main points came up. Number 1, patients wanted to be treated with humility. They want to have more spaces where they can go out and not be judged. Spaces like the group are especially important for people with children, as fellow members have a level of understanding of what they are going through. Providing spaces with barrier-free drop-in would also help accommodate people who may be going through a mental health care episode rather than having conditional-only care. Number 2, patients asked for better communication for explaining conditions, medication and appointments. Members of the group wanted to be told through clear phone calls, not emails or text messages, where they can get locked out of if they forget their passwords. Number 3, patients asked for empathy from the NHS staff and managers. They don't want to feel like inconveniences. Like Vinny said, he would like doctors to take it into consideration that patients are people. Lastly, I wanted to point out that I attended an event called Speak Out for the NHS on the 3rd of June, where Rachel invited Andy Burnham to visit the group via video call. Andy said he'd come, but he has yet to appear, and his office have pushed back a potential date till late autumn. Just one more example of how people with long-term mental health issues are marginalised. Thank you for listening to this episode of the Northern Rose podcast, and if you have enjoyed it, you can subscribe to our emailing list for free, or head over to YouTube and subscribe to our YouTube channel at the Northern Rose News. Thank you for listening.